Hi there. Our today's topic is avoid these sex positions during pregnancy. You know that pregnancy seems to amplify everything: hunger, moodiness, and even libido. Unless your doctor says otherwise. It's perfectly normal to get it on during pregnancy. All you need to do is keep some tips in mind. On that note, here are some tips about positions you need to avoid during pregnancy and what you can do during pregnancy. Here is a trimester-wise lowdown on how you can engage in sexual intercourse when you already have a bun in the oven. First trimester. With the onset of the first trimester and that nasty not-so morning sickness, you probably aren't feeling as sexy as you normally do. And sex is typically the last thing on your mind. But, if the mood so beckons, you can have sex in all positions. The best part is that you don't have to worry about that big belly for a while, and that hormonal surge will make it extra satisfying. According to Dr. Stryker, anything goes during the first trimester, and there are no restrictions. What this means is that there are no positions to avoid at this time. He adds, when you look at the data on miscarriage or early pregnancy loss, there doesn't seem to be any connection. Second trimester. The second trimester is when your libido typically hits an all-time high. The initial symptoms of pregnancy like morning sickness and the fatigue begin to subside, and you are more open to the pleasures of coitus. The second trimester is also called the honeymoon trimester, and you'll be ready to bring the sex back now. However, with that baby bump beginning to appear, it does get uncomfortable to try certain positions. You can enjoy doggy style and reverse spooning. But traditional positions where you must lie on your back, like the missionary position, could be stressful. According to Dr. Stryker, when you lie on the back, the bloated uterus exerts pressure on the aorta, which in turn hinders blood flow to the placenta. If you are a bluff old traditionalist, who just can't enjoy carnal pleasure without going on a mission, consider wedging a pillow under your left hip. Third trimester. So, it's the home stretch now, and most of you aren't in the mood for some nookie. However, that balloon that you're carrying around may force you to be extra creative in bed. While there are no sure-shot rules for avoiding any positions in the third trimester, as always you need to avoid positions where you have to lie on your back. This rules out the missionary position. Moreover, the baby bump makes it tough for you to have sex in positions you were earlier enjoying. Typically, a position where you don't have to exert any stress on the belly and where you control penetration is the ideal one. As enticing as the option may seem, anal sex is a strict no-no. It can lead to a bacteria or microbe transfer from the anus into the vagina, and infect hemorrhoids. When it comes to oral sex, you can totally enjoy it over the course of your pregnancy. However, your partner shouldn't blow too much air into your vagina. In rare cases, it could lead to embolism, a condition where an air bubble can block a blood vessel. So, there you have it. Apart from the missionary positions, and the ones where you must lie on your back, you can safely enjoy sex during pregnancy. However, you must consult your doctor before you attempt intercourse, as women who have high-risk pregnancies can endanger the fetus health. Thanks for watching, and like, subscribe and share this video with your friend who love this. Goodbye.